This week's Hannah's Hero isn't just one person. It's a team of doctors, nurses, and other volunteers bringing healing not inside an office, but out on the streets.
Their main goal is to improve access to medical care for the homeless by linking them to primary care providers. And it's all donation-based. Here's News 9's Hannah's Heroes.
In the early morning hours in Wheeling, a team gathers with one purpose: help those who feel forgotten. A group of volunteers, physicians, nurse practitioners, and physician assistants all go out to help those in need. They're part of Project Hope, which stands for Homeless Outreach Partnership Effort, a mobile street medicine team that's been treating the city's unhoused and underserved since 2015. They deliver something more powerful than medicine: human connection.
If we can keep these people healthy during a time of need, perhaps it's the one thing that will give them that step up to get their life back in order.
The story starts with one man, Dr. William Mercer. In 2006, as Wheeling's new health officer, he traveled to Philadelphia for a national health conference. The conference covered many issues, including homelessness, and Dr. Mercer wanted to understand it better. His first experience was interesting.
And so I took his picture, although back then we had the little cameras that went click, and he heard that and he came over and he socked me. And I realized then I didn't know anything about homelessness, and I'd like to try to learn more. And
that moment didn't scare him off. It opened his eyes. That experience became the spark for what would become Project Hope.
It's something that gives me satisfaction, and I know it's needed.
Today, the team includes more than 30 regular volunteers, 20 of them doctors, nurse practitioners, and physician assistants. Every week, they treat around 20 people, offering help for infections, wounds, and more.
The group that we have, oh my gosh, compassion is just pouring out of all of them.
They start their rounds at Catholic charities, then head to local homeless encampments. Most patients have some form of insurance, but little or no access to consistent care. The care comes via a mobile medical unit called Penny. It's a van with 2 fully equipped exam rooms, running water, and space to perform procedures they never could before. But their care is much more than physical.
Drug addiction is an illness. So we're trying to get people to understand, if you got diabetes, that's an illness. If you have this drug substance use disorder, that's an illness. I don't see a difference, but a lot of people do say, well, why can't they help themselves? Why do they want to be like this? Gosh, if you walked in my shoes with them, you would understand.
This isn't just about stethoscopes and prescriptions. It's about dignity. The team treats every patient with the same care and respect they'd want for their own family.
If they are seated, we're going to be seated. If they're on the ground, we're going to get on the ground, so that we can build relationships with them. And that's what has made our program so successful.
And over time, those relationships bloom into hope. Ambrosia Castello has been part of Project Hope's patient family for 10 years. Today, she's drug-free, working toward her goals, and just landed a new job.
It impacted me big. I had not seen the brighter days for a long time. I have not touched any kind of pills in almost 11 years now. I'm thinking clearer, thinking better, don't want to stay away from it, everything.
To her, Dr. Mercer is more than a physician. He's family.
He was able to help me stabilize housing. He was able to get me back on the proper meds that I needed, help me stabilize my life to where I was able to get back on my feet.
Project Hope educates patients about mental health, addiction recovery, and healthier lifestyles. They also run a 1-for-1 needle exchange to prevent the spread of HIV, hepatitis, and abscesses. But there are also heartbreaks. Some patients never get the chance to recover. The volunteers hold a memorial every year for those who have passed.
You get attached, and it's just, you always wonder why, what else could you have done?
Still, they keep going, week after week, because to them, every life is worth fighting for.
I don't think anybody plans to be homeless or works at being homeless, and I don't think having food or having someone check your blood pressure enables anything. You know, this is not an existence that anyone chooses to have.
The people around them see the impact too.
They're amazing, the people that work for them, what they're willing to do for their patients and their clientele. It's truly remarkable. You can see that they care, and in a world today, we need more people like Project Hope. If they weren't here, we'd have a whole lot more problems.
In a world that can be quick to judge and slow to help, Project Hope chooses empathy every single time. Their work is living proof that compassion heals, and that sometimes the best medicine isn't found in a bottle, but in a conversation, a connection, and a team that shows up. For information on how you can support Project Hope, visit WTOV9.com. For Hannah's Heroes, I'm Hannah Hayes.
Hi, I'm Dylan Cleland. Thanks for watching. And here's another video to check out, and be sure to subscribe to our channel.